For the Medicaid director, sir, you had mentioned that obviously the state needs to catch up on the funds because they've capped the funds at the county level. Can you tell me, with 1 in 3 New Yorkers on Medicaid, who sets the guidelines and the parameters for who is eligible to get Medicaid? Is it the state or the county governments?
It begins with the federal government, then it's the state.
So the state and the federal, but not the county. So with that being said, you know, with what other states besides New York still saddle county governments, local governments with a local share of Medicaid?
We don't have that offhand. There are a handful, and different states structure their county relationships differently, but we can get back to you with that information.
Well, I spent 10 years in county government, and I believe New York is one of the last ones. But so my question is, if New York State controls who's eligible and what benefits they receive, New York State's the most generous, I believe, of all the states as far as those Medicaid benefits, then how do we justify taking federal money away from counties to fill that gap?
I don't necessarily think that's the way we are justifying it. There are things the state has done to expand Medicaid coverage and benefits and services. We've absorbed all of that cost. All of the growth since 2015 has been absorbed by the state.
But the state also set those parameters. And does any other state have 1 in 3 of their residents on Medicaid? Any other state besides New York?
I think California may. But in any event, what I was also going to say is since the PHE, March 2020, the counties really have not had any responsibility with respect to Medicaid eligibility or administration. So for the last 3 years, they have not had to change or dedicate any resources towards Medicaid administration. They've actually repurposed those staff to deal with other county needs while the state has reimbursed their Medicaid admin at the current rate that we pay. During that time, we've taken over a lot more of the Medicaid administration than had been previously in place, and I think those are important considerations.
Well, yeah, but it's still the largest line item for every county government. And you say that they've not taken over the responsibility. They also have no say. Would you be in favor of county governments being able to determine, each individual county, what Medicaid benefits they give to their residents that ask for that? I mean, I think that'd be a great solution, wouldn't you think? If the counties want to.
They do have a role in some of the long-term care determinations and eligibility. Counties employ nurses that do the assessments and.
Well, it's very limited. No, I'm asking you a very specific question. Would you be in favor of having county governments determine which Medicaid programs they offer in their counties as a way to stem the cost of Medicaid?
No, I would not.
Okay, so then why are we taking money away from the federal government that the federal government intended for counties when clearly New York State government is completely in control of what this program looks like and who's eligible for it?
All I would say is that there's multiple funding streams. They're including multiple federal funding streams. Not all of those streams are being taken from the counties. There are funding that we've received from the federal government that will continue to be paid to the counties.
Thank you.
Thank you.